My name is John Muniz. I'm one of the local pastors in the community of Second Reformed Church. And I would like to direct this question to you, Mr. Kelly. I know it's not easy for you to be here tonight. I want to thank you. Our team put together a question in 4 parts. And it goes like this. The language that Prime has used, or should I say, the inconsistent language, which is the concern why we're here tonight, to describe their commitment. What is precisely Prime pledging in 4 areas? Staying open as a full-service hospital is the first question. The second part to that question is providing specific services the hospital currently provides. The third question is actively engaging the community and its leaders in determining what programs and services will be added, modified, or even terminated. And the last question, sir, what are we planning to do to retain the current staff? And I thank you for your answer.
Thank you for the question. To go to the last question first, I would like nothing better than to look at every staff member of Christ Hospital and guarantee that they have jobs forever, or as long as they want them. I can't do that. We are going to be laying off employees. We're going to be laying off probably somewhere in the area of 50 people, 50 individuals who will have their jobs impacted. That's not being done because of Prime Hospital or Prime Healthcare. That's being done because I have an obligation and responsibility to make sure that I present a balanced budget that can ensure that the remaining employees have job security. And even with those layoffs, I'm not sure that I can guarantee in the long run that other changes won't happen. So I'm very committed, the board is committed, we are committed to our employees. And you know, some people say, well, 50 employees of 1,400, it's a very small number. It's a small number except for the one employee that I have to look at in the eye and say, you lost your job. And I've had to do this before, I don't enjoy it, but it has to be done. In terms of the services that are going to be provided, again, in the CN application and the CHAPA application, Prime is committing to maintain medical, surgical, cardiac, maternity, child, and psychiatric services at Christ Hospital, and emergency room. Virtually all the services we provide now. In fact, the first investment of that first $15 million is going to go to a critically needed expansion of our emergency room. 50,000 patient visits a year in a facility that was designed to see 19,000 people 25 years ago. It's an embarrassment. We have fabulous staff, and they do a fabulous job, but it's an embarrassment, the confines they have to do it. So we're going to invest in that. And again, these commitments are being made, they're in paper, they're in writing in there, and I think I missed one of your questions.
The other one was, well, you did answer in terms of full service, and you did answer the fact that you are going to keep the present services that you're providing. So thank you very much. For me, that's